This is a brief presentation on Epoetin alpha. Epoetin alpha is a glycoprotein that exerts the same biological effects as endogenous erythropoietin that is produced by the kidney. It stimulates the division and differentiation of committed erythroid progenitors in the bone marrow, increasing red blood cell production. It is FDA approved for anemia due to and following chemotherapy in patients with HIV, CKD, or those undergoing an elective non-cardiac and non-vascular surgery who are at high risk for blood loss. There are other indications, however, these are non-FDA approved. It is administered either IV or subcutaneous. IV is recommended for dialysis patients, and the dose and frequency vary based on the indication. It can be as often as 3 times a week or once every 4 weeks. Contraindications include serious allergic reaction to the medication, uncontrolled blood pressure. For infants, neonates, and pregnant women, only use the single-dose vial, as the multi-dose vial contains benzyl alcohol, and pure red cell aplasia that begins following the treatment with the medication is contraindicated. There are common adverse effects. Most commonly are dermatologic and GI, including injection site pain, pruritus, rash, nausea, and vomiting, among others. And there are some serious adverse effects to consider, although less common. Increased cardiovascular event risk, CHF, hypertension, acute MI, erythema multiforme, SJS, TEN, DVT, hypersensitivity, CVA, PE, tumor progression. These are all very serious conditions that have to be considered. There is a black box warning. I'm aware this is a lot of information, but please read through it. These medications increase the risk of death, MI, stroke, and other serious cardiovascular events. In CKD, they're at greater risk, and we're still not quite sure what the goal hemoglobin should be in these patients receiving these medications. And in cancer patients, there are several types of cancer that actually have increased risk of tumor progression if they receive this medication. And if the patients are receiving this medication preoperatively, please note they still need DVT prophylaxis. In pregnancy and breastfeeding, fetal and infant risk cannot be ruled out, so you'll need to weigh the risks and the benefits. There are monitoring needs, including monitoring the hemoglobin during and after therapy, monitoring the serum ferritin, transferritin, monitoring the blood pressure, and monitoring for change in neurologic symptoms. And as always, counsel your patients. Tell them about the potential serious and common side effects. Tell them when to come back to the hospital or when to return, when to call for guidance on side effects. And note that these medications can cause dizziness, so they shouldn't do anything that requires a lot of coordination until they know what their side effects are going to be. Micromedics is my resource. Thank you.